In case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I call myself your bump to bassinet bestie because we are here to talk all things pregnancy, all the things you don't want to talk to your provider or your friends about. I just did a post about your first poop after birth. And so that's really what I am here to be, is your pregnancy bestie. So ask me your questions. I would love to answer them. Um, just more information about me. I have two websites. One's called Pulling Curls, like curly hair. And my second website is The Pregnancy Nurse, and they both have pregnancy information. Pregnancy Nurse tends to be a little bit more like pregnancy evidence-based. I'm quoting a lot of studies on there. Pulling Curls has the podcast. And sometimes, like, I just did a post on there about tips for new moms, especially talking about lowering the expectations. So tell me if that's something that you guys struggle with. I would love to know that. Thank you for the lights. I sure appreciate it. But ask me your pregnancy questions. I'm just getting up Instagram in case people are asking me questions on there. Mute the site first. There I am. Yeah. So pooping after birth, we can chitty chat about that really quickly. Does anybody have any questions about postpartum, managing life postpartum, things like that? I would love to chitty chat about that. But make sure that you are taking your stool softener in the hospital, and it is not Colace or Ducosate sodium. Studies have shown that Ducosate, which is what I took with my first baby, it's what I offered tons of patients, which is why I was so spicy when I saw that study. It just doesn't work. So I usually recommend Senna, Metamucil, Miralax, something along those lines. They tend to work a little bit better. Oh, we have a question on Instagram. How dangerous is a breech vaginal delivery? I'm expecting twins, and my doctors keep saying both my babies have to be head down for vaginal delivery. Jay asked that on Instagram. So most of what I've seen is only twin A needs to be head down. Because twin B, as you can imagine, let's pretend like these are two babies. My headphones. When twin A comes out, a lot of times this one cartwheels, and so it doesn't really matter what was head down in the beginning because we don't know what, as A comes out, twin B often can turn. So, but I've seen plenty of breech deliveries on baby number 2 because by then, usually that baby's, anyway. I have heard that providers can get in trouble for any breech delivery though. So there's that. You can always make the choice to have whatever type of delivery you want in the hospital, but if your provider really is not good or comfortable with breech deliveries, that's something you need to consider. That'd be like hiring a tile guy and then asking him to like do your roof. My roof is tile, but it's not the same kind of tile. You know what I'm saying? You just want to be sure that the provider you have is going to be good with whatever it is you're doing. So great question. Once again, every decision is up to you, but you need to decide if it's the best thing for you. Let's see. I'm scrolling back to questions. I'm 36 weeks, 6 days, and started light brown spotting. Is that normal? It can be. Some small amount of spotting can be normal. It's really important that we talk about, Jay, you're welcome, the different types of spotting that we have. So you can have bright red spotting. That means that bleeding has been more recently and is usually a little bit more disconcerting. Light brown or brown would be older blood. Okay, which is a little less disconcerting because it doesn't mean that there's an active bleed. And you have to remember that the birth canal can bleed a little bit more because of the increased blood supply, either from just like sex or more like working out, stuff like that. It just can get irritated and bleed a little bit more. So bright red bleeding, I would call your provider about unless you're in active labor. But always, if you have any questions, talk with your provider. Any tips on gestational diabetes, 30 weeks and 3 days, and just failed my test? I'm stressing. I could totally understand that, Nicole. First off, it is only less than 10 weeks of doing the diet. And I personally actually felt so much better on the diet. I was shocked by it. Now, that doesn't mean that I didn't a couple of times fill my carbs with a very small brownie, and then I had a nice piece of chicken with it. But usually it's controlled with diet. You are going to need to check your blood sugars. If you consistently find that your blood sugars are well and you don't want to keep taking them, talk with your provider. But usually they start out with just diet. So you're going to be working on the diet, and combining proteins and carbs is really going to help you feel so much better, I think. Mona said, can lightning crotch round ligament pain start as soon as 5 weeks? Well, so you're releasing some hormones to start opening up that pelvis, and your uterus is growing. So your ligaments can get stretched early in pregnancy. I a lot of times find that people complain about ligament pain when the uterus is starting to grow. We have periods in our pregnancy where the baby isn't growing a ton, but then as you get like into the 30s weeks, the baby starts to grow more and people will feel that ligament pain. So it could be at 5 weeks. Yeah. Talk with your provider though if you have any questions. You deliver your baby at home. Like me personally, no. Or the breech vaginal delivery of twins, I wouldn't recommend that. I mean, could you deliver your baby at home? I don't know. I don't know the midwives will do twin deliveries at homes. I don't know. You're welcome, Kaylee. Sorry, I'm sure I butchered that name. Have you ever dealt with placental abruption? Absolutely have. You're welcome, Nicole. Yeah, the placental abruption is when the placenta detaches from the uterus, and as a nurse, you'll see increased bleeding. It's tricky because in labor, you'll have what we call bloody show, which can be very normal, but there's kind of a line where it crosses over where you start to get nervous. That's the importance also of continuous monitoring. If we were to see bleeding, we'd want to do continuous monitoring, not intermittent auscultation. And just watch. Now, there can be larger placental abruptions that are really problematic. So thank you for the likes from everybody. Keep asking your questions. I have seen placental abruptions. They're pretty rare. It's amazing that the uterus stays attached with all the contractions and stuff. Whitley said, I just had one in September. I had no idea it was even a thing. So scary. Yes, they can be super, super scary. They can also kind of not be a huge deal. When the placenta comes out, we just see that a little bit of it has detached, but baby is fine. Baby is meant to compensate for a lot of things, which can include a small abruption. So, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am your bump to bassinet bestie that's sharing all things pregnancy. I would love to answer your pregnancy questions here on this TikTok, Facebook, Instagram, YouTube live. I think I've caught up on all the questions. I was doing lives really frequently until I had my appendix out like 2 months ago, and no one would have wanted to see my live for quite a while there, but I'm trying to get back into things. So I love it when you guys ask questions. It tells TikTok to bring more people here. Cassie says, is pregnancy happening this month? Suffered 2 miscarriages in the past 8 months. Oh, Cassie, I hope that it does. I am really sorry about that. That is so hard. I hope good things for you, though. Crystalline says, does having a retained placenta and hemorrhage before make it more likely in the future? It depends on why you have a retained placenta. If they knew why, most often I think it just randomly happens. I don't know that it happens more frequently on other births. Now, hemorrhage, we know, I'm thinking that your hemorrhage was caused by the retained placenta. So as long as your placenta all comes out, then you're less likely to have a hemorrhage. I don't know if you had like previous uterine surgery or anything like that, but if you have a previous condition that caused the retained placenta, then it would be more likely to happen this time. But I a lot of times have patients who come in and are like, hey, I bled more last time. And so at delivery, I make sure that all the meds are in there. We might even make sure that we have blood type and crossed for you. It just depends on how bad the hemorrhage was last time, what they had to do, things like that. But there are a lot of things that we can do to stay on top of the hemorrhage. Thanks you again for all the likes. You guys are so good to me. Please keep asking your questions. Cassie, you've been taking prenatals. Oh yeah, everybody should be taking prenatals if there is a chance that they could become pregnant. So good job. That's awesome. Any recommendations of what could help get pregnant? Gosh, Cassie, I'm so sorry. I don't know. Now, if you've had a history of miscarriages, have you talked with your provider? those are the things I would recommend. For me, it took a long time to get pregnant, but I worked evening shift. My husband worked day shift, and it was our third baby, and we just didn't see each other very much. And when you don't see each other, it's very hard to get pregnant. But I'm guessing that's not the advice you need. Hello. Thanks for everybody for joining. I'm 22 weeks today. I find myself waking up in the middle of the night on my back. Is that bad? KB said. They used to say past 20 weeks, you want to make sure that you're on a tilt. I have read some studies that show that it's like not a big deal either way. I don't think I ever knew that on my first pregnancy. And then I learned it when I was a labor nurse. I started being a labor nurse before I got pregnant with my second baby. And I was talking to my manager, like freaking out because I was like, sometimes I wake up on my back. What am I supposed to do? Sometimes I pull the wedge out or whatever. And she's like, Hillary, if it really was a problem, you would also not be getting a blood flow to your feet. So your body would somehow wake you up if it really was a problem. In the hospital, we always want to promote good blood flow. And there are times that you can see baby's heart rate chill out when you turn a patient a little bit than when they're flat on their back. Does that mean that it's a problem when they're at home? I don't know. If you can try and sleep on your left-hand side, try and do it. But I got to tell you that the stress of like making sure you're on your left-hand side is also not great for you. So try and do what you can. And studies show either side. It doesn't have to be left. So if you like sleeping more on your right, sleep on your right. And it doesn't have to be like all the way on your side. It really just has to be tilted. You got to think like if this is your vena cava, the baby's on here. And if you're tilted one way or the other, the uterus just tilts right off. But if it's flat there, then it can squish that blood vessel. That's what we're trying to avoid. Jay asked, any lactation tips for increasing milk supply in the first few days, weeks? Anything you can do prior to delivery? I refer all lactation information to the Breastfeeding Mama. You can find her on all the social media networks. She does recommend a prenatal consult. My personal verdict on those is a little bit out, especially if it's your first baby, Jay. I'm not sure. You're having twins, so I'm sure you want to increase your supply as much, but I've always been told that there really isn't anything they can do to increase your supply ahead of time. I had issues breastfeeding, and by third baby, I had been a labor nurse for 7 years. And so I was like grasping at straws trying to make breastfeeding work with that one. And all of the realistic lactation consultants I talked to said there really isn't anything they can do ahead of time. So you can try and collect colostrum, which might be helpful for you, Jay. But I do find that a lot of people just like go crazy with it and they have hundreds of syringes saved in their fridge and you're not looking for that. But I should also say that I leaked colostrum and I don't really get milk. So just because you are leaking that colostrum doesn't mean that you're going to be a big milk producer, which is a real bummer. Anyway, there you go. The Breastfeeding Mama is my buddy Katie, and she has great information. So I would recommend checking her out. Let's see. My two tubes are cut and tied and burnt. I've been so nauseous lately. Could I be pregnant? I mean, I doubt it, but tubules are not 100%. You can always get pregnant. KB, you're so welcome. 7 blessed. I'm 15 weeks pregnant, baby number 6, and I don't feel pregnant at all. I mean, hard to say. I feel like every baby has different symptoms. Every woman has different symptoms. So have you heard the heartbeat? Things like that. Everybody is so different and every pregnancy is so different. It can be really hard. Jay, you are so welcome. Keep asking your pregnancy questions. I'm going to be here for a little bit longer. Callie, how do you feel about iron infusions? Regular OB said I needed to do them. My MFM doctor said not to do it. Wow. Okay. So usually the MFM overrules your regular OB because they're the high risk doctor, but I would definitely ask each of them why. The MFM might have a specific reason that they say not to do it. We definitely do iron infusions in labor and delivery if your hematocrit's low enough. And then on your end, I would make sure that you're eating all the red meat and spinach and all the things that can increase iron yourself. But talk with them about why. Don't just go with, well, I say you don't need it. Ask them why. Ask them, tell them what the other doctor said and ask them why they recommend what they're doing now, and then try and make a decision that's right for you. Before we keep going, in case we haven't met, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm also the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth. It is an online virtual birth class where we go through everything from pregnancy, labor, birth, postpartum, the whole thing. And you can come join me in there anytime. I'm just sitting there waiting to chitty chat with you and get you prepared for your birth. So if you guys have any questions about taking a birth class or questions about my class, I would love to answer them in the comments. And if you use coupon code, I think it's Pregners. Let me look it up. You can get. Let me look up a coupon code for you guys because I'm so glad that you're here. Coupons. If you type in code FASTERBIRTH, FASTERBIRTH, you get 10% off tonight. JJ baby, spotting and some smaller cramps at 9 weeks after a stressful day with my toddler. Normal, right? Spotting isn't my favorite. It can be. I would try and take it easy, and you might want to talk with your provider. And I honestly am not awesome with stuff before you hit like 20 weeks because I just didn't see that in labor and delivery. Harriet asks, will I be pregnant by the end of the year? I have no idea. Suggestions for gas buildup. 18 weeks and just have gas bloat. I'm not sure if you can take simethicone during pregnancy. You cannot take Pepto-Bismol. See what foods cause it. Increase your activity. See if you could take a quick walk after dinner. I'm sorry. Sometimes you just feel super bloated during pregnancy and it sucks. But ask your provider if there's anything you can take. Oh, so your MFN said that she doesn't believe in iron infusions, so they pump you with before to tolerate them are so bad. I don't know. I've done iron infusions. I don't see them a whole lot. But if you need it, it's better than being anemic. So taking progesterone suppository, but no side effects. Is that normal? I am not sure. That's a little earlier than what I usually deal with. I'm 10 weeks. I'm discharging more than normal. Is that normal? Yes. A lot of times during pregnancy, because of the increased blood flow and probably the buildup of the mucus plug, you can increase your discharge, which is annoying. Unicorn Princess, hello. Have you had your baby? All is well. Thank you so much. I had to take off a while ago. I had an appendectomy and things were ugly for a little bit, but I'm back. I'm 39 weeks, past few hours, stomach been getting tight, egg mild cramp, not sure. It counts as a contraction. So usually contraction, your uterus will get hard. If you're laying down, you should feel it get hard, but they may feel like cramps. They may feel like contractions. You can also have what's called irritability that just feels like just like a crampy uterus, which doesn't like last as long. Remember, contractions usually only last a minute. If it's lasting longer than a minute, it could be something else. So yeah. KB, somehow it hid your comment, but any tips for fast and healthy delivery? I've heard lightly working out, walking can help. I recommend things ahead of time, things like eating dates, making sure that you're doing squats throughout your pregnancy to make sure those hips are opening up, learning how to relax your pelvic floor, things like that. And also getting prepared for birth, because a lot of times you see people coming in and they're anxious about birth, and that is not helping them have a faster birth. So I always recommend to people take a class to get prepared. Tell me in the comments if you've taken a birth class. I think they are so, so important. And I do think that sometimes hospital classes don't prepare you as much as you hope they would. I know that happened for me. Oh, Unicorn Princess lost one of the twins at 24 weeks. I am so sorry. Do you know anything on how labor goes when that happens? So sometimes the one twin gets absorbed. Sometimes the other twin is there. Is that what you're meaning? But it would, in general, they treat it like a singleton delivery. Stacia says it's very tight and uncomfortable. They do last a minute, kind of nervous, but ready to deliver, I'm sure, at 39 weeks. Just keep an eye on it. Really, I ignore any pains that are more than like 10 minutes apart. Once they start getting closer than 10 minutes apart, I might start to notice them, but I try to just, when I'm that far enough along, if you're earlier in pregnancy, that's different. But if you're close 37 weeks plus, trying to just ignore those pains can often be beneficial than like counting them and watching them and stuff like that. 6 months today, my kicks are getting lighter and lighter. Should I be concerned? So the amount of kicks might change, but sometimes over a period of a week, the like how you would characterize the movements can change, which can be disconcerting. But you have to remember that as baby gets tighter in the womb, sometimes the kicks aren't like boom, they're just a lot more squirming and stuff like that. So that's it. Once you're past into your third trimester, which I think you would be at 6 months, although it's always confusing, you want to start doing kick counts and make sure that baby is moving. Prior to 28 weeks or so, that's your third trimester, babies don't tend to have like a movement pattern. So yeah. Alexis says, I love your channel. Thank you so much. That is so sweet of you. I appreciate it. So make sure you're doing kick counts. Everybody should be doing kick counts if they're past 28 weeks. Sorry, guys. I was worried because it was just something I didn't ask questions on after everything. Yes, and keep asking questions at your appointment, Unicorn Princess. That's something that they should have information for you about, like kind of what happened and stuff. 16 weeks pregnant with a monodi twins, baby has developmental curve insertion, a single umbilical artery. Oh man, that's tricky. So I'm sure they'll be ordering lots of ultrasounds and make sure that you just have keep an eye on it. You're going to want to make sure to do your kick counts and make sure you're doing those appointments. He's kicking now, but not as strong. So again, the characterization of the kicks may change. And if it's a day-to-day, like he was a strong kicker yesterday and today it's really changed, I would go in. It's not something you want to mess around with. Alexis says, I'm 10 weeks and have no symptoms. I have an 8-week ultrasound, heartbeat good at 158, but no symptoms, normal. I didn't have any symptoms on my first baby. Not to one. I was maybe a little bit extra tired, but how do you even know? I don't know. I was a nurse, so I was tired a lot too. So it really just depends on every baby. Third baby, I was like, I think I have cancer. I'm going to die. I was so tired. Again, I was a nurse plus 2 other little kids. So it just really depends on every baby and just how things go. They took fluid and blood to run tests because they can't identify the mass. Yeah, interesting. Well, I hope everything turns out okay. That's tough. In case we haven't met, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am your bump to bassinet bestie here to answer all of your pregnancy questions. I'm so excited that you guys were here. Last time I did a live, there was no one here. I don't know if your comment got filtered. Maybe ask it again. I literally did a live to one person last time, so I'm so glad you guys are here and asking questions. My husband was dropping my daughter off at an appointment or like a little church thing tonight, and I was like, I'm gonna do a live, and he was like, sure you are, because last time I was like, that was awful. So anyway, I'm so glad you guys are here. I got an appointment on Friday, so I'll get checked on Friday. Yeah. Should you be worried about miscarriage in the first trimester? I mean, you can worry about it, but there really isn't that much that you can do about it. If you have questions or concerns, talk with your provider. I was told my baby had PRUV. I'm not sure what that is. Sometimes people have different like acronyms for things in different areas of the country, and I'm not sure what that is. But I'm so sorry. That's tough. Do you have anything about skipping the sugar pill and its side effects on birth control? They say that you can skip it and there are no ill effects. It means that you just don't bleed. I love to follow Paging Dr. Fran. She's been on my podcast. Seems like a real nice lady about birth control. She's got a lot of great information. 16-year-old pregnant here. How do I know Braxton Hicks or contractions? Oh my goodness. It is so tricky. So the main thing is that labor turns into like active labor. Usually, because the contractions start to get closer together or stronger, and there are other symptoms, including diarrhea, backache, sometimes GI issues, nausea, things like that. Those are usually the way, but I would definitely talk with your provider. I actually talk way more about that in the online prenatal class for couples to just to know like what is okay and what's not okay. because you really want to stay at home as long as you can. You don't want to be going to the hospital for every little thing. So yeah. Also, how far along are you? If you're still early in pregnancy and you're having contractions, you need to go in. You are at a risk for more preterm labor being a young mom. Best of luck to you, though. Addison Sosby, how much Dr. Pepper is too much? I know that there is a caffeine number, but I don't know the number off the top of my head. So you're going to want to look at that. Are you having sugary? I don't. There's all these things you just have to decide. There's so many people that are like, oh, the sugar, oh, the aspartame. I don't know. Make your choice. I'm not a huge soda fan, so I don't know too much about it. And I actually don't drink coffee. So I never knew the caffeination numbers, but people say it is 100% safe. So persistent right umbilical vein. I don't know what that is. Sometimes there's a lot of stuff on ultrasounds that we just don't know about. So why am I having contractions but not dilating or anything 38 weeks pregnant? So your uterus is going to have contractions all the time that may or may not do anything. All that is very normal. It's just, it may be softening your cervix. It might be moving baby into the birth canal a little bit more. And sometimes your uterus is just contracting because that's what it does. So I wouldn't be concerned about that. I'm guessing you've been checked at your appointment. Maybe don't get checked, like if it's bothering you, because it doesn't really show anything other than that you're not dilating. But just because you're not dilating now doesn't mean even in an hour you could start to dilate after some great contractions. So there's that. After suffering miscarriages, finally pregnant, had my first beta draw, and it's 129. I think that's a great number. I don't know much about beta though, but I'm so happy for you, Madison. That is awesome. Congratulations. Am I pregnant with a boy? Zero clues. Zero clues. We have a question on Instagram. Please keep asking your questions. I'm having low milk supply, but baby is not having bottle milk. So you're not giving baby bottle milk, or they're not taking it. Again, I send everyone with breastfeeding issues to the breastfeeding mama. She has lots of help. I do recommend that if you are trying to get baby to take a bottle, to have dad offer it, not you, because they're used to you offering your bosom. And whereas if it's dad, even if you leave and run to the grocery store, maybe try and have dad do it for a little bit. I'm 16 weeks and my belly hurt to touch, but no pain otherwise. Interesting. That's something I would bring up with your provider. It could be like an infection, or it could be nothing. It's hard to say. Can you eat spicy food like Bulak's spicy noodles while you are pregnant? You can. It's not going to hurt the baby, but a lot of people complain about heartburn when they eat spicy foods when they're pregnant because baby kind of shoves up your stomach, and there can be an increase in heartburn. So that's just something to keep an eye on. And you may react more to the spices. Sometimes people say they do that. Is it okay to try for a baby if you aren't ready? No one is truly ready for a baby, right? I don't think so. I mean, I tried for three years to get pregnant with my last one, but even when I found out I was pregnant with her, I was super overwhelmed. So take that for what it's worth. And I'd been a labor nurse for a long time, had a 8-year-old and a 5-year-old. Still didn't feel ready, even though we had hoped and prayed for that baby for a long time. So, I mean, define ready. Our relationship was ready. We had money for a baby. But then all of a sudden you're like, oh my goodness. Yeah. 7 days past ovulation, can't stop testing. Is this a sign? The fact that you can't stop testing, is that a sign? I'm not sure that that is a sign of pregnancy. But good luck. I hope things turn out well. I'm having, let's see. Rupashri on Instagram says the baby's not taking a bottle. So have dad offer it. Maybe try another brand. Maybe have your mom friend come over and offer baby a bottle, especially if they've given a baby the bottle before. Are they hungry and they're just not taking the bottle? Sometimes you have to kind of wait a while, but I would talk with your pediatrician about it. How can I get good sleep? I have a pillow, but nothing helps. Try and address what the issue is. So if you're like having to pee all night long, I tried to cut off fluids after dinner time. So I drank like a ton during the day. And then after dinner, I tried to cut off fluids. If it's your hips, maybe try some stretching before bed. You might need to double up on pillows, things like that. Can you take Tylenol PM 28 weeks? I can never recommend people take medication. Sorry, guys. You have to talk with your provider, but usually you can. You didn't hear that from me. If I'm ready is not financially ready, is it okay to still try if you aren't financially ready? Honestly, babies are not that expensive beyond if your insurance is crap, which I sure am seeing a lot of people saying on social media. Hold on, guys. Got to silence my phone. Are you still there? So I don't know. I think financially ready is a different bar for everybody. So those are my thoughts. If anybody else has thoughts, tell me in the comments. I'm having hot flashes and growing pains, but all I get are faint lines and I'm 22. Faint line is still a line. Usually the second line on a pregnancy test is not as dark as the initial line. I don't know why, but if you go to the pregnancy nurse, I have a whole post on faint lines in pregnancy tests that you might want to read. Just type in faint lines into the search bar. I took antibiotic when I went to my second trimester. Will my baby be okay? Hopefully they knew you were pregnant and they put you on an antibiotic that is safe for pregnancy. Keflex at 6 weeks and 5 days safe. Usually talk with your provider, though. They need to know that you're pregnant. Before you take any medications, you need to talk with your provider. What does low fetal DNA and low fetal fraction mean during the NIPT test? I'm sorry, I do not know a lot about that because that was early. Usually amoxicillin's fine. So is it okay for work for a baby if you work part-time? You can still make it work, right? I think there's a lot you can do with a baby. An actual baby is not that expensive. If you add on childcare, if you add on crappy insurance, that can end up being expensive. But compared to like teenagers, the actual baby beyond childcare usually is not too expensive. And sometimes you just make it work and you forego other things because you're home all the time with that baby that you love so much. 6 weeks today with baby number 3, super crampy this time, normal. The other 2 didn't cramp this much. Every baby's different. The baby may have been planted in a different spot. Your uterus just may be expanding different this time. When you have your appointment, I would definitely tell your provider those things. But every pregnancy can be different, just the way that it implants in the uterus. All right, you guys, I think I answered all the questions. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I'm your bump to bassinet bestie, and I'm the creator of the online prenatal class for couples. I would love to see you guys in there. I do think every couple needs a birth class, and this one is super easy. It starts at $89, and if you use coupon code Faster Birth, you can get 10% off tonight. So come join me in there. If you have any questions about my birth class, please ask them in the comments. Christina said, does egg quality decrease as you get older? I'm 28, so it's best to start trying now. It can. Usually they say before 35. So you still have a little bit of time, but if you feel like you want to get pregnant, give it a try. I don't know. Talk with other friends and obviously your partner. If you and your partner feel like, okay, we can do this, then do it. Definitely not something you want to like hide from your partner though. No heart rate during a 6-week 1-day ultrasound. Is that normal? They may just have your dates wrong. So baby may be too small. You might be less than 6 weeks. And then when did they schedule an ultrasound later on, they will see a heartbeat. That happened to me on my first baby. And then we went in, like 10 days later and they could see a heartbeat. So yeah, they just had my dates wrong. I'm a late ovulator. All right, last call for questions. So good to see everybody here tonight. I love answering pregnancy questions here on social media. Again, come join me in the online prenatal class for couples. I would love to have you guys in there. Coupon code FASTERBIRTH will get you 10% off the class tonight. So that's either the $89 class or the $197. So that's a good amount of money off the class. Come join me. Save a little money for some onesies. All right. My most recent article on the pregnancy nurse, which you guys can check out, is, what was it? Jay said, thanks for answering questions. So helpful. I'm so glad you were here. The last one was mastering labor preparation. And so if you're looking to get prepared for your labor. That's a great post for you. And then the one before that was 3 things not to do before your induction. So if you're planning on an induction, that's a great one to check out. Is there any connect with fertility issues after taking Accutane? I do not know. I know that they don't want you to get pregnant on Accutane, but I don't know about after, how they feel. Mima said, when will I get pregnant? I do not know. I do not know. If I knew that, I would make so much money, probably, right? Anyway, thanks for joining me, everybody. Thanks for the follows. Thanks for the likes. It was so nice to meet everybody here tonight. I'm going to try and do lives Wednesday evenings, same time every week. So maybe I will see you guys around then. Thanks for coming. Bye.